Brennan Jen, a doctor at Hartford Hospital, told me one of the biggest reasons is people are afraid of catching COVID-19 at the hospital. But he says that should never be a reason to put your health last.
America has missed more than 9 million cancer screenings in the last 2 years because of COVID. 9 million.
President Biden speaking earlier this week on his mission to reduce the death rate among cancer patients in the United States. This is because doctors are seeing more patients arriving for treatment with more advanced diseases. Dr. Ken Robinson, the chief of emergency medicine of Hartford Hospital, telling Fox 61 what is contributing to this rise. The pandemic causing staffing shortages, a lack of available appointments, not being able to afford the costs that come with cancer treatment, and most commonly, concerns about the risks of contracting COVID-19.
All the offices and medical centers have been doing this for a couple of years now and know how to keep the place clean and keep people safe. And if there's one message I would say, do not delay seeking medical care or getting your usual screening tests or things like that.
The good news, hospitalizations have significantly dropped now that the holidays are over and less people are planning gatherings. Regardless, Dr. Robinson says fear of COVID-19 should never be a reason to stall.
When we ask their history, they seem to be giving a little longer period of time of symptoms than we had been seeing before. And people seem to be, oftentimes seem to have worse symptoms.
It's not just cancer symptoms he's seeing. It's also serious respiratory symptoms leading to congestive heart failure. According to the Connecticut American Cancer Society, 1 in 6 patients report a delay in their cancer screening schedule. 1 in 10 experienced a screening delay for a cancer which they had previously been diagnosed with, and 1 in 5 reported they were not given prevention information by their doctor.
People aren't going in and getting their mammogram, so they may have their breast cancer diagnosed later. People aren't able to get their colonoscopy, so they might have their colon cancer detected at a later stage.
The American Cancer Society is urging lawmakers to increase funding so patients can get financial assistance when it comes to those higher out-of-pocket expenses. Live in Hartford, Carmen Shao, Fox 61 News.